It's time for another edition of Sports Insider, brought to you by Faith Regional Health Services. I'm News Channel Nebraska's Chris Whitney, and before we get to the action, we're joined by Erin Baumert, physical therapist with Faith Regional Rehabilitation Therapies. Erin, thank you so much for joining us today.
Thank you for having me.
Now, today we're talking about reducing sedentary behaviors. In the new year, lots of people want to adopt some new habits and lifestyles, but the key is making them stick and making those last. What are some of the major factors contributing to the difficulty with staying healthy and keeping those behaviors?
Well, there's two major factors contributing to the obesity problem in the United States. Lack of physical activity and sitting too much. So there's research that goes back as far as 60 years showing that people that have physically active jobs have less coronary artery disease than people who have fairly sedentary jobs. There's also research linking sitting and other health issues and causes of mortality. Even if people are meeting their minimum physical guidelines as far as the 30 minutes a day, it's still recommended that you get up throughout the day. So that's the problem with more and more people having sedentary jobs where you're not moving around as much during the day, just to encourage that. So,
what exactly makes it so harmful then to sit so much?
Well, the lack of activity throughout the day can decrease or impair the body's ability to deposit fat from the bloodstream, and this can cause increased risk for cardiovascular disease.
How can someone then start to create their own active plan to reduce those sedentary behaviors?
Well, according to the American College of Sports Medicine, there is still the recommendation for 30 minutes a day of physical exercise, such as your walking, riding a bike, swimming, whatever your form of exercise that you prefer is. But throughout the day, it's also important to try to incorporate movement both at work and at home. At work, try to get up, from your desk. Every time you take a coffee break, take a walk break. If you can stand instead of sit, some of, like I said, the forward companies are incorporating standing and sitting desks where people can alternate between the two. If you're talking to somebody just on the phone and you're not doing anything else at your computer, try to get up, move around, stand instead of sit for that as well. Taking the long path to the bathroom or the stairs if you can. And then at home, try to incorporate more activity as a family if you can. That can just be a good example for your children too. Try to increase your activity if you're watching TV. Get up between commercials. If you read, try to get up every few pages or stand and move. Everybody has cell phones, so you're not connected to the wall, so you can stand up when you're talking on the phone too. So
sounds like some great tips. Erin Baumert with Faith Regional Rehabilitation Therapies, thank you so much for joining us today.
Thank you.
And that's another edition of Sports Insider, brought to you by Faith Regional Health Services. At News Channel Nebraska, I'm Chris Whitney.